Dr. Avni Kardani is actually here. She's a pharmacist. Actually, she's the Way to My Heart's pharmacist advisor. Dr. Kardani, thank you so much for being here. We talked a lot about supplements. Can we start there and potential drug interactions that you see, particularly the drugs that are prescribed for people with vascular diseases and the interaction with many of the supplements that are popular today?
Yes, yes, omega-3s, which are definitely very helpful in reducing cholesterol and otherwise antioxidants, etc. You want to keep in mind that omega-3s also have interaction with certain blood thinners, namely if you're on Coumadin, also known as warfarin. You want to make sure that you inform your doctor or pharmacist who's monitoring you that you're taking that supplement, because they will need to adjust the dosing based on that. Also, vitamin E, it's a great vitamin, antioxidant. However, it is one of the few vitamins that accumulates in your body. So it is also good to ask your functional medicine doctor, what dose to take and how often should I monitor? Should I take any holidays? Same thing with vitamin D, vitamin K, vitamin A, if you're taking those. These are the vitamins that do accumulate in your body, and you need to make sure that you're taking the correct dose and taking a holiday off of them when it's necessary. Aside from that, one of the mainstays of peripheral artery disease, your doctor might prescribe you Platal or Salastazole. Now that medication is essentially a blood thinner as well. So other supplements like ginkgo or kava, garlic, turmeric, all those also interact with that, and they may potentially increase your risk for bleeding. So anytime you start a new supplement, I would suggest that you inform all your medical professionals that, hey, I'm taking this and this. Is there any issues that I need to, look at? Specifically nutritionists and pharmacists, because doctors are busy, they are specialists, and, they don't always know exactly what you're taking. However, pharmacists has access to all your medications in front of them. So they would be better equipped to tell you that, hey, here's an interaction. Just make sure you tell your doctor that, you're doing this. So it's really good to talk to your healthcare professionals. A couple of people actually recently asked me if they should take nattokinase, which lowers your blood pressure. It may lower cholesterol. It can be neuroprotective. It does have some positive qualities, but also has a blood thinning effect. So you need to, once again, make sure that, even if you're taking aspirin, you need to make sure that you are telling your doctor that you're taking these supplements. Same thing with Serrapeptase. It's an anti-inflammatory, but once again, it acts as an aspirin or NSAIDs like ibuprofen or naproxen sodium that you might get over the counter. So if you're adding all those things together, you want to make sure that, you're one of your healthcare professionals, or all of them, ideally know that you're taking these things.
So what are some of the new vascular pharmaceuticals from a pharmacist perspective that you think that both patients and specialists should be aware of right now, and potentially the standard protocols for prescribing them, as well as the potential side effects?
Sure. So the new pharmaceuticals currently available, the most recently approved was an already a present blood thinner called Xarelto. It is a blood thinner, but that has been used for other indications such as, deep vein thrombosis and other cardiovascular diseases. But it was recently also approved for peripheral artery disease at a low dose. So that is something that can be incorporated into your regimen if your doctor thinks it is necessary, to further thin your blood. So Xarelto for the clinicians, it was approved, I think it was last year in October, at a low dose, 2.5 milligrams twice daily, along with a low dose aspirin. So that is something, a very standard blood thinners side effects to monitor for. So if you have any signs or symptoms of bleeding, for example, if you have a nosebleed for a long time that is not going away, or if you see blood tinged urine, if you're vomiting and it's coffee ground looking, type of look, if your stool is black, tarry, or very red, these are the symptoms that you have bruising that are not healing or just getting bigger. So these are the side effects that you want to mention to your doctors as soon as possible. Other couple of medications that are fairly new, I would say about 5 years or so, are for cholesterol reduction. So one is the Repatha or evolocumab, and the other one is kind of a sister med, it's a Praluent or alirocumab. So those are two medications that are great for reducing cholesterol. They can be taken, your doctor might put you with, even if you're taking statin or without statin. So it depends on if you can tolerate statin, and you need additional cholesterol lowering, then your doctor may put you in one of these medications. Or if you're not able to tolerate statins, then this might be a good choice for you. It doesn't have the very terrible side effects or the common side effects that statins have of the muscle breakdown, the muscle pain. So from that sense, they're safer. One of the side effects that they do have that very similar to statin is diabetes or your increased blood glucose levels. So your doctor would probably want to have you monitor your blood sugar levels at least initially or periodically while you're taking this medication. Some of the other side effects that have been shown to be common are upper respiratory tract infections. So, also influenza. So if you're taking these medications, you want to make sure that you get your annual flu shot to reduce that risk for flu. And once again, these are injectables. So you would be injecting them every 2 weeks or every 4 weeks, depending on what your doctor prescribes you. So you might also want to look out for injection site reaction. If you're also on blood thinners, you might bleed easy. So that's also something to keep in mind. However, it's not as frequently injected. So hopefully it wouldn't be an issue. It also has some gastroenteritis, etc., the type of side effects, but they're not very common. But if you do feel, it's very difficult to tell sometimes chest pain versus heartburn, especially if you have just come out of a major surgery or if you have just been diagnosed with new symptoms, you're not aware of, what is different. So if you feel like it's a very, painful heartburn, or you can't tell what it is, you want to tell your doctor. So these are some of the medications that just recently got added to our therapy.
Well, pain medication is also a top prescription when it comes to PAD, as it's one of the most debilitating diseases, as many of you already know from personal experience. What's important for not just patients, but also doctors to understand about pain and prescribing meds for it? Because pain meds work very different, and it's important to know what's triggering it before prescribing one versus another.
Absolutely. Absolutely. Pain is a very subjective topic, and it is very difficult for doctors to determine what type of pain it is, without asking very, very specific questions. And for patients to also very keep in mind and kind of monitor what exactly they're feeling. What type of feeling is it? Is it a crushing pain? Is it a tingling, burning sensation? Is it irradiating? Does it also have swelling involved? So we have peripheral artery disease pain that can mostly be commonly is seen in calf muscles, sometimes thigh muscles or buttocks muscles, but they're generally after you have done some sort of activity. And it resolves after, let's say, about 10 minutes of rest or so. So that's something to kind of keep in mind, that, okay, what is my pain doing, so that you can give your doctor the correct information. Neuropathy, that can be very different. It could occur if you have history of diabetes, if you've had shingles, if you've had stroke. So you're at a higher risk for neuropathy, or neurological pain. But that pain would be burning, stinging, like tingling or stabbing type of pain. And that pain would usually be worse at rest and at night. So these are the things that you want to tell your doctor. It would be very painful if you're even gently touched. So that's a neurological pain. Spinal stenosis or compression, if you have like a pinched nerve or something, that's going to be relieved by just sitting down or changing posture. Okay, it won't really show up with activity. It could be just at rest as well. So these are all these different types of pain, along with statin related pain. Though that pain is also very difficult to tell from your peripheral artery disease pain. So with statin related pain, it usually affects larger muscles. So like your thigh muscles or your shoulder muscles, and it won't come with activity. It will be at rest. You feel like you worked out really hard, your muscles are sore and they're painful, and these are the big muscles. So, and it's a constant pain. So so you will need to know what type of pain it is. Another thing that you want to look out for if you're on statin is if you have abnormally dark color urine. That's also an indication of statin related pain. So these are the things, and like Dr. Hines mentioned, maybe CoQ10 could help. It hasn't known to help everybody and always, but it is something that has shown to show some sort of support when you're on statin. So if you're statin related pain, the best treatment that you're going to get is possibly a CoQ10 supplement, or they're going to reduce your statin dose or possibly even discontinue the medication. There is other ways that doctors can do things, like some of the statins are water soluble that have less potential to cause statin related pain. So they might switch you to those. They can have, different type of regimen, like, oh, just take statin for like 5 days a week rather than 7 days a week, whatever works best with risk and balance for you. Although statin has these terrible side effects, sometimes they are one of the best drugs to improve your cholesterol. Even if it causes diabetes, it's very difficult to have a new diagnosis on your record. It's really scary. But at the same time, have this discussion with your doctor that, hey, okay, so this is it, but what are my cardiovascular risks? Do I really need statin? Okay, diabetes, if it's low, you can, with diet and exercise, can, manage it, but don't stop statin without talking to your doctor. So that's another thing. Pad pain, general pain medication is Playtol or Celostazol. That is going to be very effective in relieving pain. It is, it has improved pain-free walking distance up to 50% in some patients. So that is the mainstay pain medication that is for peripheral artery disease. If you have neuropathy, like I said, then your medication selection changes completely. Then they would put you in gabapentin or pregabalin, something like that, to improve that pain. With spinal compression, pinched nerve type of stuff, generally pain medications do not work as well. But if you do supervised chair yoga, or if you do stretching exercises that are supervised, they would be the best way to alleviate and improve that type of pain. Another thing is arthritis, also difficult to sometimes tell, but once again, that pain wouldn't disappear right away, and it's usually worse in the morning or after a long period of non-activity. So it has that stiffness type of feeling when you wake up from naps or in the morning. And the best treatment for arthritis is like Tylenol, over-the-counter Tylenol. It may be a higher dose if you talk to your doctor, but safely. Once again, it has a lot of side effects, that are bad for your liver as well, or other medications that are also available over the counter, such as ibuprofen or Motrin, or naproxen or Aleve. So these are the medications that work best with arthritis pain. So that's there are many different types of pain. I would say that a lot of people would also inquire about opioids like oxycodone or codeine, morphine, etc. However, these heavy hitters, they have so many side effects that are detrimental, that they have, poor respiratory issues if you take it for a long time, musculoskeletal issues, cardiac issues. But these medications are good if you have a really severe pain for a short term, such as like if you've had some sort of injury, or if you had a very major surgery. So after that, your doctor may prescribe you opioids, but they're good for short term. They're not good for long term, unless it's a cancer related pain, which is a completely different, thing that, you might require opioids for.
Thank you so much, Dr. Kardani. We really appreciate you.